Hello, everyone, and welcome to E-QIP's Quick QI webinar series. And this is the recap webinar where we're going to review everything that we've gone over in the previous 8 webinars and really connect everything all together. We'll also give you some opportunities at the end of the webinar to stay connected to the E-QIP team. My name is Jenna Hitchcox, and I'm the program manager for E-QIP, and I've been with the program for 3 years, so since the inception of the program. So our agenda for today is to talk about what E-QIP is and what we offer to Ontario's community mental health and addiction sector, reviewing the model for improvement. And then the bulk of the webinar will really be about the QI process and the tools that we've learned about, and we're going to review some of the tips and how they all connect with each other. Then we'll go over our community of practice, which is our online portal of resources and discussions, and we'll talk about how to connect with the E-QIP team. So this is a review, but the E-QIP project or initiative is a partnership between Addictions and Mental Health Ontario, Canadian Mental Health Association Ontario Division, and Health Quality Ontario. And our mission is really to support the adoption of quality improvement methods and tools in the community mental health and addiction sector. And E-QIP is based on the existing commitment to quality that we've observed through the community mental health and addiction sector. We're just building on that through formal QI processes and tools. So quality improvement is simply defined as a method of continuously finding better ways to provide better client care and service. It's moving beyond some of the more quality control related activities, such as looking for the bad apples, and also moving beyond quality assurance, which is really measuring if you're complying to standards or not. It's all about continuous improvement for the long term. These are the 3 models that are regularly used in quality improvement and the E-QIP team has adopted. On the right-hand side of the screen is really the ultimate goal of the quadruple aim. And that is really what we're hoping to get out of all of our quality improvement work. So it's better care for individuals, improved provider satisfaction, lowering costs, and better healthcare for people that we serve. So all of these aims. In the middle is the model that we also strive for, which are the domains of quality. These are really all of the components that are globally recognized as important for high quality healthcare to be provided. So you can interpret this as high quality care is equitable, it's timely, it's client-centered, it's integrated, it's effective, and it's safe. So when we do quality improvement work, we really want to be making sure that all of our projects and initiatives at least cover one of these domains. The model for improvement is the practical how-to toolkit and questions that we work through as we're developing and implementing a quality improvement project. It gives us 3 guiding questions as well as tools associated with each of those questions, and encourages us to think about how we can do small tests of change before fully implementing a solution or change idea to really make sure that it works the way that we want it to. And this is what the E-QIP team uses as a linear model to work through a quality improvement initiative or project. And so we start with preparing for quality improvement, and then we look at really understanding our problem, and this is what we call the diagnostic tools. We also have many tools that we use that help us measure and understand our system. So this is all about data and how can we be sure that we have a problem and to what degree is that problem happening at the beginning of a project, but also how can we make sure that throughout the project life cycle we're seeing improvements, and measures give us a way of doing that. Developing and planning solutions is all about really looking at your root causes to a problem that you identified in your diagnostic stage or in the understanding the problem stage, and coming up with creative and innovative solutions that people are excited about trying. Finally, is the PDSA, or the testing and implementing change phase. And this is where we take those really exciting ideas and we test them on a small scale before fully indicating to staff and our clients that this is the new way that we're going to be operating. And finally, there are some tools to support our ability to sustain and spread our quality improvement goals, either across organizations, to different services or programs, or to other organizations that might be able to benefit. And on the left-hand side of the screen, you'll also see the experience-based co-design approach, which is a toolkit from the UK and the National Health Service. These are tools that really help us understand what's happening from a client and staff perspective on the problems that we're trying to address. And you can see on the right-hand side of the screen, each of the phases of QI relates to a key model for improvement question, such as what are we trying to accomplish, how will we know that a change is an improvement, and what changes can we make that will result in an improvement, followed by quick plan, do, study, act cycles. The first tool that we reviewed with you was the project charter. And the project charter is really a tool that you're going to use from the outset of a project all the way until the end. It really is a communications tool for you to be able to quickly communicate with others in your organization and as a quality improvement team where it is that you're at in the project, what it is that you're striving to achieve, and what are some resources and people that are required for you to get there. It allows us to have a common understanding of what we're doing, a common understanding of our aims, our measures, and the plan for the project execution. Some tips on this tool is that it's important to recognize that this is a fluid tool, so it will change over time the more that you actually identify what it is that you're trying to achieve and having discussions with your clients and your team. Another item that we talked about that is really important for a quality improvement team is to really think about who you want to have dedicated to the project, who you want to be on that team. And really having a clear outline of who is responsible will allow for accountability, as well as avoid the pitfall that one person is effectively leading a QI initiative. Some tips for creating a solid QI team is that you want multiple different perspectives. You also don't want too many or too few people on your team. We recommend that you usually have about 6 to 8 people working on a project at a time. That's not to say you can't include other staff members as you work through your quality improvement process, but a dedicated team of 6 to 8 works the best. And it's really important to have client and family member engagement right from the beginning. You can do that through a variety of different ways, but often if you're comfortable with QI, it's really helpful to have a client or family member or multiple clients and family members on your quality improvement team. Having a good quality improvement team will allow you to be able to complete your other quality improvement tools in a really meaningful way and have good, solid outcomes that will be able to be sustained in the long term. The second tool that we have provided to you is the 5W2H, or the problem statement tool. And what this helps us do is define the problem right at the outset of the project. Some tips for completing this tool is that it works through a series of questions with you, and it's important at this stage to focus on why and how the issue is impacting clients. If you can frame the problem from the client perspectives, you're going to have a fairly solid quality improvement project moving forward. It's really important that your problems are relevant and of high importance to clients to improve. Also, as you're working through these questions, it's important for us not to use blaming language. So quality improvement really gets us to think about what are the systems in place that are either enabling people to do their job well, or providing barriers that make it hard for people to do the job the best that they can. And so avoiding blaming language is really important through this phase of work and using this tool. We also want to try to avoid jumping to conclusions at this stage. So we're focusing on why is this a problem, not why is it happening, and we're not trying to come up with causes to the problem. That's really important, and it's often something that people get caught up on. So it's why is the problem a problem, not why is the problem happening. We also don't want to be jumping to conclusions at this stage of the project. Another key item that we want to include at this stage of the project when we're creating our problem statement is that we want to add as much data as we can that is important to define our problem. As you recall from our case example that we've been working through in this series, there was some data gathered on the wait times for case management at Live Well Recovery Services. So as you can see, there's been a growing problem of wait times over the last few years. And so what data at this stage of the game will do for you is it will allow you to be able to more easily create measures for your project to see if you're actually impacting change, as well as it will provide a burning platform for your team to actually help out with the project and make the required changes to the way that they're working. The problem statement is connected to the other tools because it really is the foundational tool for your project. It allows you to complete the diagnostics in a meaningful way. And when you're coming up with change ideas, it's really a grounding force. So your change ideas should really all be very strongly related to the problem statement. If you spend enough time on your problem statement to really understand the problem, and it will take some time, it will really provide a solid foundation for the rest of your project, and the rest of your project should be easier to do than if you have an unclear problem statement. A good problem statement helps us effectively diagnose a problem and come up with solutions that will target root causes of issues, ensuring a good use of our time and resources in quality improvement work. The next tool or statement that is really important to quality improvement is the aim statement. The aim statement is usually the flip side of the problem statement, and it answers three essential questions: how much, by when, and for whom. It's connected to the other tools in that it provides a guiding light to everything that falls out after you created your aim statement. It provides some support in motivating people to work towards a goal. It focuses efforts, and much like the problem statement, it is a solid base for developing measures and change ideas in quality improvement. The next set of tools that we reviewed with you are the diagnostic tools, and the diagnostic tools are really there to help us better understand why the problem is happening. A key principle that we wanted to share through this webinar series is that the diagnostic tools are going to help you move past a symptom of a problem and get down to the causes of the problem. And the theory here is that if we focus on symptoms of a problem, we're actually not going to be making positive change in the long term. If we narrow down and really understand the cause of the problem, then that's when effective and long-lasting quality improvement work can happen. So some of the diagnostic tools that we've reviewed with you are the fishbone diagram, and we recommend that the fishbone is more or less the starting place for your diagnostic journey. It allows you to get all of the ideas out about why a problem is happening. It is a really great engagement tool, and it really helps you get out everybody's perspective as to why the problem is happening. In order to do this well, again, you need a really clear problem statement. So again, relating these two tools together, a clear problem statement will allow you to have a really impactful fishbone diagram. Some tips of doing your fishbone is that causes should be framed negatively. So the lack of training, or the lack of knowledge, or not enough. Those types of language use is really important for your fishbone diagram. It's also, again, not blaming individuals, so you're not going to be pointing out individual causes to certain problems. It's really about thinking about what is the system that that person is working in, what are the kind of situational factors that impact our staff's ability. The connection with other tools is that the it's really a starting place for diagnosing your issues. It's the first step in a diagnostic process. It can create some sources for change ideas once you get there. So when you're coming up with your change ideas, perhaps you can revisit your fishbone diagram and look at some of the potentials for change ideas that may come out of this process. It also allows you to get, a whole inventory of your causes that you've come up with your team and your clients and the people that you're serving. That really plays into the Pareto analysis that we'll talk about in a little bit. That really helps you get down to the few causes that are contributing to the problem that you're going to want to be focusing in your efforts on. And so the next tool that we use is the 5 whys. And the 5 whys is fairly straightforward in that it asks you to ask the question why 5 times on one of the issues that you've identified in your fishbone. So if you've gone through your fishbone diagram and there's one cause that seems to be really large or needs a bit more clarity, what you can do is ask, why is that happening 5 times in a row? Some tips for this exercise is that sometimes it doesn't work out nicely and you get to a why that's either out of your control or it just doesn't make sense for your team to address. So what we recommend is that you stop asking why when you get to a cause that you can no longer control and you move up one level into something that you can control. And that is how the 5 whys can work for you. Again, you're really taking the causes identified by the fishbone and digging deeper into a few causes that need a bit more explanation or perhaps a bit more discussion. The Pareto principle or the Pareto chart as a tool is something that we reviewed with you as well. The Pareto principle is really all about the rule that 20% of the causes that were identified are leading to about 80% of the problem. And so the theory here is if we focus in on those 20% of the root causes, we're going to see improvements in about 80% of the problem. Some tips for creating a Pareto chart is that we can get data simply by voting. So once you have a nice list of causes, what you'll be able to see is that there's going to be some that jump out as really important to tackle. So you can ask your staff to vote on what they think the top 3 causes are and input that data of the number of times people voted on each cause into the Pareto chart template. Another way that you can get data is through current processes. So for example, if you have a client survey that you release every year, perhaps you develop a survey for the purposes of your QI project, what you can do is actually ask people about these causes and then use that data and input that into the Pareto chart template. What this tool does for your project, allows you to visually see what's your major contributing causes to the problem. And it's important to really understand your drivers for change or your root causes once we get to the solution phase of work. Here we have a process map that can be a diagnostic tool at the beginning of your project. And what a process map can do through a diagnostic phase is it helps you identify bottlenecks, duplications, unnecessary steps, pain points, and anything that's unclear or needs further explanation. So at this point in your project, it really can allow you to get more root causes out of your team to help diagnose the problem better. And that's really the purpose of the tool at this point. The key to a good process map is to get as many eyes on it as possible and to ask the people that work in this process closely every day to really take a look and understand, is this accurate? Did we miss any steps? What's unclear to you? What needs further clarification? And those types of questions should be asked. So at the diagnostic stage, again, this tool can help you get out some additional root causes that may not have come up in the fishbone diagram itself. This tool can also be used as future state, a tool to get out what people think the future state should look like. So once you've done the first round of the process map of what is currently happening, then you can have another discussion about what should be happening. And this is really important when you get to the change idea section of your QI project. And I'm just going to mention here again the experience-based design tools that were reviewed with you. There's lots of different resources and webinars from the E-QIP team on this that you can review if this is something that sounds really interesting to you. The EBD tools allow you to get feedback directly from staff and clients on their experiences through a process that you're trying to address. And so it really asks about feelings and the triggers of those feelings as someone is working through a process and getting care or receiving program support in your organization. On the screen, we currently have an emotional questionnaire. And this is where you ask a client to identify the emotions that they felt through all of the major stages of a care pathway when they access services at your agency. But there's several other different tools. And then once you've identified and gathered all of the information from clients and staff, then what you do is you can quantify that. And so you'll see here that for each time a word was mentioned through the intensive case management program process, it was enlarged, the font size was enlarged. So you can see under the 30 to 50 day wait time, anxious or the feeling of being anxious was reported much more than some of the other feelings in that process step. And then we talked about measures. And so measures is a really big topic, but essentially in QI, what you're trying to get at is your outcome measures, your process measures, and your balancing measures. The outcome measure is really the voice of the client or the people that you're serving. So the outcome measure should really think about, what can we capture that will allow us to understand if client outcomes are getting better or if client experiences are getting better. And it's usually very clearly directly linked to your aim statement. The process measures are the voice of the system. So it's going to be measuring things that will allow you to understand if you're moving closer to an improved aim or improved outcomes for the clients that you're serving. And usually we can't come up with process measures until we come up with our change ideas. And the balancing measures are any unintended impact that you may have throughout your QI project. And so balancing measures are really asking you, what are some of the unintended consequences, either positive or negative? So some tips here. So some tips here are to have good enough data for quality improvement. You don't need research level data. You don't need random control trials. You're really just aiming for good enough data throughout a QI project. And one of the tools that we use is the measurement plan. And the measurement plan really allows us to understand what the measure is all about, who's collecting the information, how is it going to be calculated, what's the purpose, and how will the data be collected over time. And then the other tool that we've reviewed is the run chart. And the run chart really is important so that we can understand how our family of measures are progressing over time. So it's going to allow us to understand, are our outcomes being achieved, are our process measures improving, and what is the impact on the balancing measures on the people that we're serving. So run charts can be used at the beginning of a project. So as we recall, the wait times were collected for the case management example that we've been working with before the project so that we could clearly see how long that had been an issue and a growing issue for the people of Live Well Recovery Services. So that is one place where a run chart can be useful. The second place is through, once you've started to test your change ideas, then we can look at run charts to see, are these changes working the way that we want them to? They're a good depiction of all different types of measures. So outcome, process, and balancing measures should all be mapped out using a run chart. And then after you've completed your QI project and you've seen changes in your outcome measures, what run charts can do is give us the skills that we need and the knowledge that we need to know if our gains are being held in the long term. And then we talked about change ideas and solutions. So once you've understood your problem really well, you've come up with your root causes, you've identified how you're going to be measuring things in the long term to see if those changes are actually working, then comes the fun part where you think about the solutions. And at this point, you've probably come up with several different solutions and change ideas already, but there are some tools that you can use to get past those first 2, 3, 4 different ideas that come up from your project team. So we use idea generation tools, and one of those tools is called the random word exercise, which is depicted here. And then we can also use the TRIZ exercise, which will be presented on the next screen. And with these tools comes the ability for you to work in groups in a fun way. So you can start with your QI project team for sure. And then if you want, you can actually branch out to other staff members that are going to be asked to help implement some of these change ideas. They're really fun to do as a group. As a tip, you know, they're often work a little bit better than just kind of sitting down and thinking about all the different solutions to your problem. They give you more of a structured way to get creative ideas out of your team. And it also is important when you're coming up with these ideas that you kind of keep reminding your team about what are our root causes and what are we trying to address, so that the ideas that you're coming up with are really clearly related to the causes of the problem. In order to do these exercises well, it's really important that you have a clear aim and problem statement. So we keep saying how important these two pieces of a QI project are, and they really become apparent of their importance when you're working through your change ideas. You'll have a more focused discussion, you'll have a more meaningful discussion if these two pieces of your QI project are done well at the beginning. And then once you've come up with a list of your change ideas or solutions, then you can use the impact and effort grid to understand and have discussions on what do you think the impact of this change idea will be, and what is the effort required from our staff or from our clients in order to test this idea and make it work. The other tool that we reviewed with you is the driver diagram. This is an overarching kind of project management communication tool that you can use with your team. The ingredients for a good driver diagram is for you to really understand your root causes. So you might have 3, 4, 5 really clear root causes that you can use as your primary drivers. So you kind of flip those root causes as a negative into a positive, into a primary driver. The secondary drivers are really kind of groups of some of your solutions that relate to each of the primary drivers. And of course, you're going to be adding your change ideas onto your driver diagram as well. And on the left-hand side of the screen, it really asks you to just put down what your aim statement is. Again, it's a really key piece of your project, as you've probably noticed through this webinar series. So this tool is really a nice summary tool for you to use. And the PDSA worksheet, or the PDSA cycles, which are plan, do, study, act cycles, are important to document. And they're important to document each time you test the changed idea and you build your knowledge on if this idea is working and what needs to be tweaked and adapted, and so on and so forth. Your PDSA worksheets are going to allow you to have really clear documentation as to what you tested and what happened. This is important for a variety of reasons. First and foremost, it gives rationale as to why you're making the decisions that you're making, and it helps with staff buy-in. If you can clearly articulate why you've decided to move forward or not with a change idea, It will really help with buy-in and engagement from your team. The second is, we notice in our teams that we work with is that often what happens is people leave organizations or they move roles and they no longer are the lead on a quality improvement team. So it's really great to have your PDSA cycles documented so that someone can pick up, the binder or the tools that you've been working with and really get a clear sense of what's been going on. And then we talked about spread and sustainability. So the sustainability is trying to avoid the evaporation effect. So when people are really excited about a project at the beginning, outcome measures are moving in the right direction, but then a few months later, things fall back to the way that they were before. That's the frustration that comes in terms of sustained improvement. The second one is lack of spread. So perhaps there's something in your own organization that's happening in one team or in one service of what you are offering your clients, but others don't know about it. That's really the lack of spread. And this can also happen across organizations. So if you hear about another organization that's working really well and aren't experiencing an issue that you're trying to tackle, perhaps they've adopted some practices that would be of use to you to help you achieve your quality improvement aims. So sustainability, we have one tool that we've presented, which is the NHS Sustainability Guide, and this will really allow you to go through the factors of sustainability, so your organizational factors, your process-oriented factors, and your staff factors that will or will not contribute to sustained improvement. And you'll be able to see where your gaps are and where your strengths are and come up with some mitigation strategies so that you don't lose the gains that you've experienced over time. And the spread planner works through a series of questions through a worksheet that's really all about what you want to be spreading and how that can happen. Whether or not it's within your own organization or whether it's across organizations. And this is just a reminder of the power of the project charter. So at the beginning of this webinar, the project charter was blank, but now it's all full with the great ideas that have come out of working through the QI process. And again, just reminding you about what we've gone through and kind of the linear process that the E-QIP team works with. That being said, often what happens in quality improvement work is that we move one step forward and we have to take 2 steps back. And this is because of a variety of reasons. Most commonly, what we see is people learn more about a problem as they work through the process. And so problem statements have to be adapted and refined. We find out maybe that a problem isn't really a problem. And so we go back to the beginning to focus on really what is impacting our clients and our staff. As well as some change ideas. Maybe they're not actually directly impacting the problem. They're not having the impact that we want. And so we have to go back and do a little bit more idea generation in order to get to the solutions that will make a long-term impact. So we wanted to cap that off with that kind of disclosure that we present this information very linearly, but it does not always happen that way. And it's totally common and it's expected, and it can be frustrating, but if you stick to the process and you really get a good sense of what the problem is and why it's happening, then the rest of the project should work a little bit better. So now we'll go over just very quickly how you can stay connected to the E-QIP team. We have an online community of practice that hosts all of our resources, including the slide decks that have been presented to you in this quick QI webinar series, as well as there's online discussions that you can have with others in the sector on quality improvement related work. If you're watching this webinar, you're well aware of our webinar series online. So we've done a quick QI webinar series that this installment is capping off, but there's also several other webinars with different experiences shared, as well as organizational perspectives shared throughout each topic. We also have a monthly newsletter or bi-monthly newsletter that we send out with really key important information for the sector to learn about if you're interested in advancing your quality improvement journey. So please do sign up for that. And this is the QI team at E-QIP, and we're always happy to help. And please do reach out if you have any questions about this webinar or anything else. We're always available and willing to talk to those in the sector about quality improvement. So thank you very much for watching this webinar, and we hope it was of use to you and so that you understand a little bit more about how all of the quality improvement tools fit together. Thanks so much.